All right, year 12s. This week we're going to be looking at Australia's healthcare system, which I know you looked at a bit in year 11. So some of this will probably be a bit of revision, and then also bringing in a few new concepts, mainly around these areas of sustainability, access, and equity. And next week, when we're back at school, which I'm very excited about, we will keep looking at health promotion programs and the Ottawa Health Charter, looking at a few different examples. Okay. Um, I think it's good to have at the start of your notes on this section just a quick little overview here. So when we look at Australia's healthcare system, it's kind of separated into public and private sections. So our public healthcare system involves Medicare, public hospitals, the Pharmaceutical Benefits Scheme, or the PBS, and the National Disability Insurance Scheme, or the NDIS. And these are what we're going to look at today. And on Friday, we'll have a look at the private system and also these ideas of sustainability and equity. So we'll start with Medicare, and you do need to have notes on this. It does come up in the exam every year. So Medicare is Australia's universal health insurance scheme. Okay, and when we go through kind of what it covers, that should make a bit more sense. So it was established in the 1980s, and it is run by the federal government. So basically, that means the funding for this comes from the national government, even though a lot of the services are delivered by state government. So Medicare basically covers costs for things. And that's what we mean by it being an insurance scheme. Medicare doesn't technically own any hospitals or employ any doctors, but it provides funding. Some of the things that are covered by Medicare are essential services. So things that are absolutely necessary in terms of surgery or treatment for, say, things like heart conditions, for major eye conditions, anything that is essential. It covers public hospital fees. So if someone is injured and they go to the emergency department and they end up being in hospital for weeks, that is all paid for by Medicare. The same thing if, say, someone had cancer, or at the moment, people with coronavirus, they go to a public hospital, those fees are covered. It covers GP and specialist fees, and we'll come back to that in a little bit. But in general, when you go to see the doctor or you see a specialist, some or all of that fee is covered by Medicare. It covers essential surgeries. So again, like I was saying with essential services, if someone has, say, a heart attack and needs surgery done, someone breaks their leg, they would be considered essential surgeries, and they'd be done in a public hospital and all be covered. It covers pathology and x-rays. So pathology is things like blood tests or urine tests, and x-rays, things that are done to diagnose disease or health conditions. And it also covers eye tests, and often that will include, it'll cover a certain amount of cost for things like glasses, unless you want the newest Gucci glasses, you're probably going to have to pay a bit of out of pocket. What Medicare doesn't cover are private hospital stays. So if you go to a private hospital, that will not be covered by Medicare. Most dental care is not covered. Some child dental is covered, okay? But in general, as an adult, dental care is not covered by Medicare. Ambulance services are not covered, so that's why it's quite important that people have ambulance cover through their own private insurance, or you can actually just buy Victoria ambulance cover. And I really recommend, if you are playing a lot of sports or you've got your driver's license, you should get that. It's about $40 a year, but the cost of an ambulance trip can be about $5,000 to $10,000. So it's definitely worth having ambulance cover. It doesn't cover home nursing or care. So if someone is living at home and they have a chronic health condition, it doesn't pay for nurses to come out to their house and look after them. And it also doesn't cover allied health, which is kind of a term for a range of different services such as physiotherapy, occupational therapy, psychology. There are some exceptions. So, for example, you can get a mental health care plan that will subsidise a certain number of psychology sessions, but in general, that's not just covered on Medicare. You would have to get a referral from a doctor. So one of the things around Medicare and what you need to know is how it's funded in Australia. So Medicare is funded through general taxes that are paid by Australians. So when you are working and you pay tax, some of that money supports Medicare. Other bits will go to education or to roads, but a lot of that money comes from taxes. There's also a thing called the Medicare levy, and this is basically an extra amount of tax. It's usually around 2% of someone's income that is paid each year when someone lodges their tax. The taxation office will determine a person's income, and based on that, they'll take a bit of extra money to support Medicare. And an important note here is this is not paid by low income earners. So if someone is on a low income or they're in a low kind of socioeconomic bracket, they're not going to pay that Medicare levy. And then there's also an extra levy called the Medicare levy surcharge. And this is extra tax that is paid by income earners that earn high amounts of money. Okay, so hopefully you're starting to think around this term of equity, which is this idea that people that need help more get it, and also that people who are able to provide a bit more support provide it. Okay, so once you've got those notes down, jump into question 1, which is kind of a summary of the last slide and this slide, and then come back here. Okay, so there's some advantages and disadvantages of the Medicare system. I think it's important to note that Australia's healthcare system is very good, and compared to a lot of countries in the world, we are given a lot of services compared to the US, which has a pretty bad public health system. Australia's is very good. So some of those advantages, it provides free healthcare for all citizens, and also for some temporary citizens, so people that are traveling, or maybe people that are on a visa who are applying for asylum status, it's provided free. There's also what's called a reciprocal agreement with other countries, which basically means that, let's say, someone from the UK is in Australia and they get sick, they can go to an Australian hospital and it will be covered. And also the other way around, if Australians were in the UK and they got sick and had to go to hospital, that would be covered. Okay, so it's an agreement between certain countries. It covers most essential costs, as we talked about. And I'd say kind of the big one that would be considered essential by a lot of people and is not covered is dental, and also some of the things around the allied health services. You can choose your own GP. So when you go to a doctor's clinic and you're claiming through Medicare, you can choose which doctor you go to see. You're not just assigned to any doctor. And that's really important for a lot of people to have a doctor that they trust and that they know and that knows their medical history. And it protects low-income earners. So we talked in the last slide about how low-income earners don't pay that Medicare levy. There's also a thing called the Medicare safety net, which is basically a cap on yearly payments. So what that means is if you are a low income earner, after you've paid a certain amount of money for health services in a year, you stop paying after that. Okay, so that's really important, especially for people with chronic health conditions that need lots of treatment and maybe are having to pay a lot of gap fees. Some disadvantages, when you go to a hospital, you don't get to choose your doctor, and often the same with specialists. So not like with a GP, you can't choose the doctor in hospital. There is a waiting list for a lot of treatments. So in general, really essential treatments will be covered very quickly. If you have a heart attack, you're not going to be told to wait 4 months to see a doctor. That will be done immediately. But for a lot of other things, like say you had a sporting injury and you ruptured a ligament in your knee, that is not life-threatening. So you might have to wait a few months until you can see someone to get that sorted out. It doesn't cover allied health services, as we discussed. And there's often what's called a co-payment to see a doctor. So usually what that means is Medicare covers a certain amount for a doctor. I think it's around $70, but doctors can choose their own fee. So let's say a doctor chooses to charge $100 for a consult. Medicare will cover $70 and the patient may have to pay that gap, which would be $30. Okay. Some clinics have all of the cost covered by Medicare, but often there is a small out-of-pocket payment as well. Okay, so just jump into question two and discuss a couple of those advantages and disadvantages. Okay, I want you to have a go at answering these two exam style questions. This is often the way that the questions would come up, where you're kind of linking a few different bits of knowledge. So the first one is explain one way that Medicare can promote health and well-being. So remember, we're looking here for the dimensions. So maybe think of an example, choose one dimension and discuss that. And then question 4, explain one way that Medicare can promote health status for Australians. So here you need to be choosing a health indicator. Again, think of an example. How could Medicare decrease, mortality rates or burden of disease or something like that? Okay, there's also the Pharmaceutical Benefits Scheme, or the PBS. You do need to know what that stands for. Pharmaceutical basically just means anything in a pharmacy. We're generally here referring to drugs, prescription drugs. So the PBS is a government subsidy, which basically means that the government, again, the federal government, pays a portion of prescription medicines. And there's about 5,000 different medicines that are covered by this scheme in Australia. So generally, the fee is pretty standard. So patients pay around $40 for most prescription medicines. Some are cheaper, but that is the maximum that a person will pay for any of these medications that are covered by the PBS. If a person has a concession card, so that's generally people that are on payments through Centrelink. It could be single parents, it could be low income earners, it could be people on a disability pension, elderly people. They will only pay $6.50 for that same medication. So the government pays the rest of that. And it's worth noting, some medications would normally cost thousands of dollars for a single packet. Okay, some medications for certain diseases are extremely expensive. So this is a really, really important scheme, especially for people that need monthly medications for a whole range of things. Okay, so jump in and answer questions 5 and 6. Again, one of them is getting you to start thinking about linking the PBS with your knowledge of health outcomes. Okay, and finally we've got the National Disability Insurance Scheme, or the NDIS as it's better known. The NDIS provides services for people with permanent and significant disabilities. And I'll get you to watch a little video in a minute that explains more what that means. But here we're talking about something that is lifelong and causes, pretty significant issues for a person. Okay, so some examples of this might be cerebral palsy or blindness. These are things that aren't going to get better. A person will be living with that for their entire life. The NDIS involves an individualized plan for each patient. Okay, so this will basically look at what the disability is, what the person needs, and maybe how much support that person needs. And that could be very different for different disabilities. Okay, some people might just need assistance maybe buying a wheelchair, whereas other people might need a carer that comes to their house every single day. Okay, so it's an individual plan, and that acknowledges that every disability is different and the support that people need because of their disability is different. The funding from the NDIS is for reasonable and necessary supports. And again, in the video that you're going to watch, it gives some examples of what that might be. Again, that's going to be different for every person. A person that is blind, for example, doesn't need a wheelchair, but they will need maybe assisted devices so they can use their computer, or they might need a walking stick to help them as they're going down the street. So it's whatever is reasonable and necessary for that person. And some examples of this are things like treatment, so maybe specialist doctors, therapy, so these could be things like physio or occupational therapy, speech therapy, all of those kind of things that aren't covered by Medicare, remember. Support, so that could be carers or people that maybe help a person go out to the shop so they can try and be a bit independent but need a little bit of support. And also things like assistive devices. So that could be things like wheelchairs, it could be computer modifications, it could be rails at home if a person has poor balance, lots of different things. Okay, so I want you to go into question 7. I've got the link there to the video I want you to watch and just answer those questions there. Okay, so we looked at the public system today, and on Friday we will move on to the private system and also kind of recap the whole healthcare system, looking at things like sustainability and equity. Thank you.